Hi, it's Dr. Elisha Van Dusen with today's 3-Minute Health Talk. Today I'm going to talk a little about chronic ear infections. If your child experiences recurrent ear infections, chiropractic can help by restoring normal drainage of the lymphatic vessels. Almost half of all children will suffer from at least one middle ear infection, otitis media, before they're a year old, and 2/3 of them will have had at least one episode by age 3. The symptoms of ear infections include ear pain, fever, and irritability. If you look into the ear of a child who has otitis media, you'll be able to see a buildup of fluid behind the eardrum, and the inside of the ear will appear inflamed. Otitis media is often caused by either a bacterial or a viral infection and frequently results from another illness such as a cold. For many kids, it can become a chronic problem requiring treatment year after year and putting the child at risk of permanent hearing damage and also associated speech and developmental problems. Otitis media commonly emerges when there's an improper drainage of the lymph system in the neck, when the muscle that is supposed to keep bacteria or viruses from entering the eustachian tubes, which are the tubes in the back of the throat that lead to the inner ear, doesn't work correctly. And while both of these things can happen in adults, it usually does not result in an ear infection for 2 reasons. First of all, the shape and length of the eustachian tubes are different in adults, allowing easier drainage and making it more difficult for bacteria to invade. Secondly, adults tend to spend more time upright than young children do, which also encourages better drainage and decreases the risk of infection. But in either case, the underlying root cause of otitis media is usually a mechanical problem. There is either a reduced or blocked drainage of the lymph vessels in the neck lymphatic chains, and this causes a buildup of fluid in the inner ear, or also a loss of normal function of the small muscle at the opening of the eustachian tube in the throat, which allows bacteria and viruses from the mouth to enter the inner ear. So instead of treatment that tries to kill the bacteria or virus, a more natural approach would be to restore normal drainage of the ears and the neck lymphatics, and this is most effectively done through chiropractic treatment. Unfortunately, the current treatment of choice for medical doctors is to prescribe oral antibiotics like amoxicillin, which can be helpful to get rid of a bacterial infection, but according to many research studies that they've done, antibiotics are often not much more effective than the body's own immune system. And repeated doses of antibiotics can lead to drug-resistant bacteria. Most people have heard about the common practice of placing tubes in the ears to relieve the pressure and therefore pain of otitis media. During this surgical procedure, a small opening is made in the eardrum and a small tube is placed in the opening. And this opening helps to relieve the pressure in the ear and also prevents fluid buildup. After a couple of months, the body pushes the tube out and then the hole closes. Although the treatment is often quite effective, it does not address the underlying problem or cause of the infection, which is the abnormal mechanical functioning of the lymphatics, muscles, and nerves. So if your child experiences recurrent ear infections, it's important that you talk to a chiropractor. We're licensed and trained to diagnose and treat patients of all ages, and we'll use a gentler chiropractic treatment for your kids with ear infections. By helping to restore the normal function of the tissues of the neck, otitis media can usually be significantly reduced or completely eliminated in most children without the use of antibiotics or surgery. So if you have a child who's got recurrent ear infections, come talk to us at New Hope Chiropractic, and I'll be more than happy to do a complimentary consultation. Thank you for your time and have a great day.